Tinea cruris is a common fungal infection of skin, and its fungi responsible for the cause can be divided into three groups: fungi preferring earth, geophile, fungi preferring animals, zoophile, and fungi preferring humans, anthropophile. Although there are many causes of jock itch, this term has become synonymous with Tinea cruris, a common fungal infection that affects the groin and inner thighs of men and women. In different parts of the world, different species cause Tinea cruris. In New Zealand, Trichophyton rubrum and Epidermophyton floccagem are the most common causes. The appearance is similar to ringworm, Tinea corporis. The rash has a scaly raised red border that spreads down the inner thighs from the groin or scrotum. Tinea cruris may form ring-like patterns on the buttocks. Tinea cruris can be very itchy. Tinea pedis, Tinea menuum, and Tinea cruris refer to Tinea corporis that is limited to the foot, hand, and groin, respectively. Tinea cruris or ringworm of the groin is an infection of the groin area caused by fungi. In different parts of the world, different species cause Tinea cruris. In New Zealand, Trichophyton rubrum and Epidermophyton floccagem are the most common causes. Tinea cruris, also known as jock itch. In some people, the area may endure darker than normal skin, even after the infection has been fully treated. Fungal scalp infection can be endemic, sporadic or epidemic, where embarrassment of large number of school children or in crowded low-hygiene refugee camps is not uncommon. Fungal infections do not usually go deeper than the skin into the body, and are not serious. The disease development in dermatophytosis, tinea or ringworm, is unique for two causes. Firstly, no living tissue is encroached, the keratinized stratum corneum is simply colonized. It can also reason the skin to be wet and weepy. Prevention of reinfection is a vital component of disease control. Tinea cruris is the name used for infection of the groin with a dermatophyte fungus. An infection of the groin is usually caused by anthropophile fungi. The most common species are Epidermophyton floccagem and Trichophyton rubrum. It is most often seen in adult men. Tinea cruris is a common and important clinical problem that may, at times, be a diagnostic and therapeutic challenge. Wash your groin daily, then dry thoroughly. Drying is perhaps the most important point. It is easy to put on underwear when your groin is not quite dry. The damp groin is then an ideal site for fungi to multiply. A hairdryer is useful if you have hairy groins. Use the antifungal cream and oral medications for 1 week after the lesions have cleared, because there may be fungus under the skin which is not visible with the unaided eye. Most treatment failures occur because patients stop the medication too early. Tinea cruris usually clears up quickly when antifungal medicines are applied twice daily to the skin. Apply the antifungal cream to the surrounding 4 to 6 centimeters of normal skin in addition to the rash. You can easily pick up the fungus there. It can be passed from one person to the next by direct skin-to-skin contact or contact with unwashed clothing. Jock itch usually stays around the creases in the upper thigh and does not involve the scrotum. Symptoms of these infections can vary depending on where they are on the body. The most common etiologic agents for Tinea cruris include Trichophyton rubrum and Epidermophyton floccagem. Less commonly, Trichophyton meningrophytes and Trichophyton verrucosum are involved. The source of the fungus is usually the soil, an animal, usually a cat, dog, or rodent, or most often, another person. Staying in a bathing suit greatly increases your chances of acquiring jock itch. Please subscribe to our channel and give this video a thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.